I've been practicing dentistry since I graduated dental school in 1983 from Temple University in Philadelphia. And then after that, I joined the Navy, where I served for 21 years on active duty and retired as a captain for the United States Dental Corps. I wanted to do something different and wanted to go into the civilian sector and practice oral surgery here in East Lyme. One of the things that we take a great deal of pride with is the way we treat our patients. And I can honestly say that I think that we treat our patients far differently than many other practices.
Walked in that door, I was a nervous wreck. And he just put his hands on me, held my hands, and just said, it's going to be okay. And I'm looking at, no, it's not going to be okay. No, it's not going to be okay. It's going to be okay. We're going to treat you well. And he just made my whole heart just go, back down. And all my nerves went back down, all my shaking and everything. It was like having my dad, actually, really helping me and calming me.
I think it's really exceedingly important that the patients have a great experience from the moment they first make their appointment to the time that they're completed with their surgical care.
Well, he's so kind and he's so welcoming. So I think just that personal touch and really getting to know me made me feel more like I wasn't just a patient. I was kind of a friend coming in and he was helping me out. It was almost like they were excited to see me, which always makes me feel good when I'm like, yay, you're here.
I think most people, when they come in being nervous, like the fact that they can relax and kind of let their hair down a little bit, and they know that everything is it's a fun-loving atmosphere around here, and it's okay to be nervous, and
Yeah.
we'll work with that.
Absolutely.
He explains the procedure right up front. He tells you how you're going to be sedated, what you're going to be feeling, and he also just explained that I'm not going to feel anything.
When he's in a room with you, he's in the room with you. End of subject. The clock is not an issue. And I think, when you're entering into an oral surgeon's office where things are going to be a little different from, say, just a general dentist office, you want that comfort level. You want that time. You want your questions answered, and he absolutely is going to answer any questions that you have and put you at ease. So
You don't get that a lot at different offices. You may get the PA or the hygienist. When you come here, you have Dr. Engel.
I'll tell them exactly what they should be experiencing, both pre-operatively and post-operatively. In addition to that, explain all the risks and the benefits associated with their surgical procedure.
If you go to a doctor's office and you're checking in and you're standing there and you're standing there and you're being ignored, we try so hard not to do that. Even if we're on the phone, we acknowledge you. So it's not like, oh, you're invisible, I don't see you. We really want you to be comfortable.
And you feel that when you walk in. You feel comfortable, and you are having some invasive work done. So the fact that they have you smiling is pretty good.
You turn into family. I mean, we just welcome you.
it's nice to hear, I hope I don't have to come back, but we love you guys.
Yeah. And we tell people, stop by. You're going to the shack? Just stop in and say hey.
And
I'd
they
love
do.
to see you. And they do. And we love it.
I really enjoy my patients. It really makes it extremely rewarding and fulfilling.
We love what we do, and I think that shows.
Yeah.
Sometimes I wish I had to have more stuff done just so I could come in here. I mean, I felt loved. They've been very good to me. Very, very good.